My day job is in the NHS, so I work in acute medicine and intensive care. And I also teach medical students at the University of Birmingham. And my evening and weekend job, my other job, I'm like Batman, is essentially to work with astronauts and keep them healthy. So my favourite subject at school wasn't actually science, it was ancient Greek and Latin. So I really liked the classics. And the way that it links to medicine is that a lot of the words that we use in medicine are derived from Latin. So languages are actually very pivotal. It was a long road because I didn't immediately know that I wanted to be a doctor. I probably realised in upper sixth or in sixth form when I was in year 13 doing my A-levels. For my A-levels I did maths, the sciences and further maths as well as critical thinking. So that's what I did at school to get me into university at Birmingham. So I went to Birmingham University to study medicine. Before I applied for medicine, I also applied for physics as well and genetics because I wasn't really sure when I was 18 what I wanted to do. I knew I liked science, I knew I liked languages, but I wasn't sure exactly which of those I wanted to specialise in. So essentially, when I applied for medicine, I didn't know that I could combine it with my love for physics. And it was only in second year of medical school when the European Space Agency announced this opportunity to do an aerospace medical course that I applied for that. And it was a competition where you had to design a new way of doing CPR in space for astronauts. So I applied and somehow got in and ended up going to Cologne and flying over there and working with flight surgeons to develop my idea further. And ever since second year of medical school, I've just been doing one project and then a second project, and it just sort of snowballed into who I am today. I think as a woman of colour within the space sector, it is becoming more diverse now. I am a mentor for the UN Space for Women programme. I always say that humanity is diverse, there's good and there's bad, and what you need to do is always be positive and approach people and tell them about yourself, because discrimination comes from a place of the unknown. So if they don't know who you are and they don't share, what you're doing, then that's where it stems from. So if you educate someone and tell them, about yourself, then it's likely to break down those barriers. This is an exciting time because commercial space is really taking off. Essentially, with commercial spaceflight, you're getting astronauts that are octogenarians, you're getting astronauts that have lots of different health problems as well. So you need doctors more than ever, you need life scientists to come up with countermeasures to keep them safe. You don't just have to do medicine, you can do a lot of any life sciences degree if you wanted to do aerospace medicine or work in the sector. We work with engineers, we work with space life scientists, so people who do genetics and genomics, people who do space physiology. So you don't just have chemistry, you don't just have to be a doctor to do space medicine. With the UK Space Life Sciences Association, we work with so many different people from all walks of life, doing cellular biology, looking at plant life, looking at fungi, etc., astrobiology, in order to try and answer the questions that are still unanswered. And there's a huge list of questions that we're still trying to find out the answer to in terms of aerospace medicine. So my everyday, so today I'd normally be working in acute medicine, so in A&E looking after frail geriatric patients, so older patients. I deal with anything from strokes to infections, for example. Space Day, so in a few weeks I'll be in Vienna and I'll be at the Mission Control Centre, so we look at screens, making sure the telemetry from suits, so that means that the ECGs or the heart tracings from the suits are transmitted to us as flight surgeons, and we make sure that our astronaut crew are safe within the suit. So my objective on that day is to make sure my astronaut is alive within a suit. And we have lots of data on a screen to tell us whether or not, they're doing well, and we can tell them to stop exercising in the suit, because wearing the suit is quite heavy. So it's about 60 kilograms in weight, so you have to be quite athletic to wear the suit. And they're in the middle of a desert, so it gets quite hot. So with the analog missions and the spacesuit testing, you have to be quite careful to have lots of breaks, just like you would if you were on a treadmill. And you have to make sure you have lots of fluids as well. I love what I do because I think that there are a lot of spin-offs from the space medical sector to the terrestrial sector. So everything that I do within the aerospace side, I try and think about how will this help my patient in the NHS. So if I have an intensive care patient in front of me, how is the space stuff helping with that? For example, an artificial heart device was developed by engineers and medics at NASA. And when I found out about this, I was even more interested in aerospace medicine. But it's called the LVAD device. We use it in patients who are waiting for heart transplants in kids as well as adults. So I think that's just one example of a spin-off from the space medicine side to the terrestrial side, and that's what drives me to do what I do every day.